The United Nations, in partnership with the federal government of Nigeria, is exploring a joint social protection initiative to tackle poverty, improve health, and fast track social development in the country. The stakeholders, including UN organizations, UNICEF, UNDP, ILO, and WFP, made this known during a joint program close up event in Abuja with the theme Scaling Up and Sustaining Social Protection System in Nigeria, initiated in Sokoto State with 6,000 beneficiaries, is funded by the Joint SDG Fund. UN resident and humanitarian coordinator in Nigeria explained that the joint program aimed to contribute to poverty reduction, good health, well-being, and reduced inequalities in Nigeria.
If Nigeria seriously wants to lift the almost 100 million people living below the poverty line out of poverty, the key is the economy. We have to find ways of revitalizing the economy. That means creating jobs, really, because social protection at the end of the day is a measure in the absence of having a job. And so I think the critical thing is fixing the economy, and that's not going to be done in the short term. Cash transfer is an important mechanism, and I was pleased to hear from both federal and state government officials that they recognize the value of supporting vulnerable people through cash. It's more dignified, it gives vulnerable people choices. So all in all, it's a small-scale intervention. You know, Nigeria's problems are huge, but it's potentially a transformative one if we can learn from it and scale it up.
Social protection specialist with UNICEF in his remarks said that the key aim of the project was to kickstart policies around social protection.
This program is transformative. It's trying to kickstart policies around social protection, integration of different disciplines, so access to health, access to education, access to social services more generally. It's also looking at the methodology to how to digitalize payments, trying to ensure that at the state level, where social protection is at its most crucial, that the state has the right policies, the right mechanisms, and the right intent to be able to help children and women to access services in a more friendly fashion.
Similarly, Mr. Clement Abba, Minister of State for Budget and National Planning, said that the project's funds had impacted the country's social sector positively, especially the review of the National Social Protection Policy.
I wish to appreciate the 4 UN agencies comprising UNICEF, UNDP, ILO, and the World Food Programme for their efforts in ensuring that the funds were adequately utilized in achieving the plans and programs that had direct bearing on the lives of poor and very vulnerable Nigerians. The zeal to end poverty and other deprivations must go hand in hand with strategies that improve health and education, reduce inequality, and spur economic growth, for which the joint fund was judiciously appropriated. The federal government, in its committed to ending poverty, established Social Protection Policy Framework 2017 to 2020, which is currently being reviewed to address social investment gaps, social housing, the conditional cash transfer, government enterprise and empowerment, national homegrown school feeding, and the community and social development programs coordinated by the Ministry of Humanitarian Affairs, Disaster Management, and Social Development.
Secretary, National Joint Association of People Living with Disabilities, PWDs, in Sokoto State, who is also a beneficiary, said that the intervention had touched their lives.
We have access to free healthcare services. Most of our people are engaged in that direction in the sense that the registered person with disability in various clinics so that they can access free healthcare services. Also, they have access to quality education in the state. Before, we have many children with disability that are out of school. Now presently they enroll in schools.